Here's a statistic that may genuinely catch you off guard. Once you pass the age of 30, your body begins to lose muscle mass at a rate of roughly 3 to 8% every single decade. What is even more concerning is where this loss tends to hit the hardest. Your glutes, which are the largest, strongest, and most powerful muscle group in your entire body, suffer the greatest decline. Yet there is something important that most doctors rarely explain in detail. Walking, the activity almost universally recommended for older adults, does very little to truly strengthen your glute muscles. In fact, evidence tells a very different story. A study published in the Journal of Electromyography and Kinesiology revealed that normal walking activates only about 20 to 30% of your gluteal muscle fibers. Now compare that with targeted glute exercises, which can engage as much as 90% of those same fibers. That gap is enormous. And weak glutes are not merely a cosmetic issue or about having a flatter backside. Research published in the American Journal of Physical Medicine and Rehabilitation found that older adults with weak gluteal muscles are 67% more likely to experience falls that can result in hip fractures, loss of independence, and even life-altering complications. Adding to this, a separate study from Harvard Medical School demonstrated that glute weakness is directly associated with chronic lower back pain, knee issues, and impaired balance that can make everyday tasks, like climbing stairs, feel frustrating or even impossible. Now here comes the truly unexpected part. You do not need to perform squats. You do not need to do lunges. You do not even need to stand up at all. Some of the most effective glute strengthening exercises for adults over 60 can be performed entirely while seated in a chair. Researchers at the University of Wisconsin discovered that certain seated movements can generate glute muscle activation levels comparable to traditional standing exercises. For individuals dealing with knee pain, hip replacements, or balance concerns, this finding is nothing short of a game changer. In this video, I am going to walk you through the most effective sitting exercises for rebuilding glute strength after the age of 60. These exercises are ranked from helpful to absolutely essential. And the #1 exercise on this list is one that physical therapists have relied on for decades to help patients recover after hip surgery. Clinical trials show that it can boost glute strength by as much as 31% in just 8 weeks. Most people have never even heard of it. But once you understand why it works so well, you will want to start doing it immediately. Before we begin, take a moment to let us know your age and where you are watching from by leaving a comment below. We read and respond to every single comment. Now, let us begin with exercise number 6 and work our way toward the most critical one on the list. Starting at number 6, we have seated marching. This exercise may look extremely simple. And honestly, it is, but do not mistake simplicity for lack of effectiveness. Seated marching is what exercise scientists refer to as a foundational movement. It gently activates your hip flexors while beginning to re-engage your glute muscles in a meaningful yet safe way. Think of it as the opening act that prepares your body for what is coming next. A study published in the Archives of Gerontology and Geriatrics examined the effects of seated marching in adults aged 65 to 80. After 12 weeks of consistent practice, participants experienced a 19% improvement in hip mobility and a 14% increase in lower body coordination. These improvements matter because mobility and coordination form the foundation that allows your glutes to function correctly in daily movement. To perform this exercise properly, sit in a sturdy chair with your feet flat on the floor and your back supported against the backrest. Your knees should be bent at approximately 90 degrees. Slowly lift your right knee toward your chest as high as you comfortably can without leaning backward. Pause at the top for a full second, then lower your foot back to the floor with control rather than letting it drop. Repeat the same motion with your left leg. That completes 1 repetition. The true effectiveness of this exercise comes from the lowering phase. As you slowly lower your leg, your gluteus maximus works eccentrically to control the movement. Research published in the Journal of Strength and Conditioning Research shows that eccentric contractions create up to 40% more muscle tension than lifting alone. Aim for 3 sets of 15 repetitions per leg. As your strength improves, you may add a 1-pound ankle weight to increase difficulty, but there is no urgency. Especially after 60, consistency always outperforms intensity. Perform this exercise at least 3 times per week, ideally at the beginning of your routine, to prepare your muscles for the exercises that follow. Moving on to number 5, we have seated leg extensions with a glute squeeze. This exercise is deceptively clever. Most people associate leg extensions solely with the quadriceps, and it is true that your quads do much of the work when you straighten your leg. However, when you intentionally add a strong glute squeeze at the top of the movement, something powerful occurs. You create what researchers refer to as co-contraction, which means multiple muscle groups are working together simultaneously. A study in the Clinical Biomechanics Journal found that co-contraction exercises improve joint stability by 23% compared to movements that isolate a single muscle group. For older adults, improved joint stability is crucial for reducing fall risk and maintaining independence. To perform this exercise, sit upright in your chair with your back supported and your feet flat on the floor. Extend your right leg forward until it is nearly straight. At the top, deliberately squeeze your right glute as firmly as possible and hold both the extension and the squeeze for 3 seconds. You should feel activation running from your thigh through your hip and into your buttock. Slowly lower your leg while maintaining some glute tension. Repeat on the opposite side. Research published in the Journal of Aging and Physical Activity found that adding isometric contractions, meaning squeeze and hold actions, boosted muscle activation by 28% in adults over 60. Perform 2 to 3 sets of 12 repetitions per leg, prioritizing quality over quantity. If you struggle to feel your glutes engage, place your hand on your glute before lifting your leg and consciously squeeze into your palm. This mind-muscle connection has been scientifically validated. A study in the European Journal of Applied Physiology found that consciously focusing on a muscle increased its activation by 12 to 18%. At number 4, we have seated hip abduction. While the term may sound technical, it simply refers to moving your legs away from the center of your body. When you press your knees outward against resistance, you are performing hip abduction, and this directly targets the gluteus medius, the muscle located on the side of your hip that is often overlooked. This muscle plays a vital role in keeping your pelvis level while walking or standing on one leg. When it is weak, your hips drop and sway, creating what researchers call a Trendelenburg gait, a major predictor of falls in older adults. A landmark study published in Physical Therapy found that seniors with weak gluteus medius muscles were more than twice as likely to experience a fall within the following year. To perform this exercise, sit toward the front edge of your chair with your feet flat on the floor, about hip-width apart and your knees together. Place your hands on the outside of your knees and push outward while your hands resist the movement. Your knees should barely move if the resistance is adequate. Hold this contraction for 5 seconds while breathing normally, then relax for 2 seconds and repeat. Avoid holding your breath, as that can elevate blood pressure. Research from the Journal of Orthopedic and Sports Physical Therapy showed this exercise activated the gluteus medius at 74% of its maximum capacity, an exceptional level for a seated movement. You can also use a resistance band for a dynamic version, which has been shown to improve hip stability by an additional 26% compared to isometric holds alone. Number 3 is seated glute squeezes. This exercise is so subtle you can do it almost anywhere without anyone noticing. Despite its simplicity, it directly addresses an issue known as gluteal amnesia, where prolonged sitting causes the brain to forget how to properly activate the glutes. A study from Ohio State University found that after just 4 hours of continuous sitting, neural communication between the brain and glute muscles becomes significantly less responsive. Seated glute squeezes help restore this connection. Sit upright with your feet flat on the floor and squeeze both glutes as tightly as possible without moving your legs. Hold for 5 seconds, relax for 3 seconds, and repeat 10 times. Research from the University of Miami showed that doing 3 sets daily increased glute activation during walking by 34% after 6 weeks. Short, frequent sessions, what experts call glute activation snacks, are more effective than one long session. Number 2 is the seated single leg glute press. This exercise targets muscle imbalances, a common issue where one glute is stronger than the other. A study in the Journal of Back and Musculoskeletal Rehabilitation found that correcting these imbalances reduced lower back pain by 41% in adults over 55. Sit near the edge of a chair, press one foot firmly into the ground, squeeze that glute, and lift your hips 1 to 2 inches. Hold for 3 seconds and lower slowly. Perform all repetitions on one side before switching. Research in the International Journal of Sports Physical Therapy showed unilateral exercises activate the glutes 27% more than bilateral movements. Finally, number 1 is the seated glute bridge, the gold standard for glute rehabilitation. A clinical trial in the Journal of Geriatric Physical Therapy showed seated glute bridges increase glute strength by 31% in adults aged 60 to 78, outperforming standing exercises. Performed with proper technique, this exercise activates up to 85% of the gluteus maximus without the injury risk of heavy lifts. Perform 3 sets of 12 repetitions, 3 times per week. Variations such as longer holds, single-leg versions, or adding resistance bands further enhance results. There you have it, 6 seated exercises capable of rebuilding weak glutes after 60. Consistency is the key. These improvements are achievable at any age. Weak glutes are not inevitable. They are the result of disuse, and disuse can be reversed. If you found this helpful, like, subscribe, and share it with someone who may benefit. Strong glutes mean fewer falls, less pain, and more years of independent living.